Welcome, I'm Nicholas Kramer, Fitness Coordinator at the Terraces at San Joaquin Gardens. Within this video, I will be demonstrating how to perform and measure the chair, sit, and reach test. Within this test, we are measuring lower body flexibility, specifically our hamstrings. That is essential for walking, our mobility, and reducing our stiffness. So within this test, you will need a couple pieces of equipment. Number one is a standard straight back chair. So something that looks like this, and again, a folding chair will work as well. And we are looking for a chair with no arms. And number two, we will need a measuring tape or an 18-inch ruler will work as well. But me personally, I prefer measuring tape as I feel I can get a more reliable and accurate reading. So now demonstrating our instructions, we have our participant here, Sydney, our concierge at TSJG. So number one, I will have the participant sit in the middle of the chair as we want their legs, specifically the hamstrings, not locked into that chair so we can increase our flexibility. Number two, we will be starting on the right side, moving to the left. So if we are measuring the right leg, our left leg will stay bent, good 90-degree in that knee, foot flat on the floor. For the right leg, we will bring that leg straight out. Our heel is on the ground, our toe is flexed at 90 degrees, so the toe is facing up, and that testing leg is straight. So from this position here, I will then tell the participant if we are stretching the right side, put the right arm on top, left arm is on the bottom, middle finger to middle finger. So from this position, keeping their back straight, we're not bending at the back, keeping their back straight, they are going to reach towards their toe and see if they can reach the toe or how close they can get. So once we see this, have the participant come back up, maybe practice one more time on this leg, and then they can move to their left leg and practice there as well. We will be doing 2 test trials within this test and just record the highest value. So again, once they feel comfortable with the movement, they had their practice rounds, then we can go into the test. Let's just start with the right side since she has her right leg out. So again, right hand on top, left hand on the bottom, middle finger to middle finger. I will have them reach towards their toe, keeping their back straight. So from here, she is exactly touching her toe. If that is the case, that score will be a 0. If they are going past their toe, you will score that in a positive value. If they are not reaching the toe, you measure the distance from their middle finger to their toe in a negative value. And the same if they are going over the toe, from their toe to their middle finger. So from here, we will be measuring to the nearest ½ inch. So let's see if she was going past her toe, which she is here. I will measure from the toe to her middle finger, which is about 2 inches. So I will put +2. If she was not reaching her toe, I would measure from her middle finger to the toe. And from here, we are at about 4 inches away. So that would be -4. Again, do 2 test trials on the right, 2 test trials on the left, and record the highest and best value. Once you get those results, they can then move on to their next assessment. And again, make sure we are demonstrating the same procedures and instructions per participant to get reliable results. Thank you and have a great day.